name is Mrs. Koya, and I'm going to go over how to give an intramuscular injection to our patient. First thing we're going to do is obtain your patient's medication administration record, check your order for the 6 basic rights. This is your first check, and check your patient's allergies. You're going to obtain the correct medication, check the MAR a second time to compare the medication label with the MAR. You're going to look up your medication in a drug reference book if you are unfamiliar with it, calculate the medication volume that is needed. Assemble all of your appropriate supplies with your syringe and your needles and your alcohol pad. Then we're going to put our needle on. Make sure your connections are tight. We're going to take our medication vial. This is a multi-vial, which means we can use it multiple times. If it is a brand new vial, we will pop off the top. We are going to put the date, the time, and the initials. Then you're going to rotate your bottle in the palms of your hand to help disperse the medication. You're going to take an alcohol pad. Every time you put a needle into the vial, you always want to re-wipe it with an alcohol pad. We're going to draw up the amount of medication. We're going to pull back to the syringe, the plunger part, and the doctor has ordered 0.5 mLs today, or a half a cc. So we pull that back to get air into it, which allows for the expansion of the medication. And we're going to inject, put the needle into the vial, and invert it in and pull back your medication to the desired amount. If you get any air bubbles, you can take your fingers and flick it, and that will help get them out. We're then going to cover our needle. We're going to take our medication and the MAR into our patient's room. I'm going to walk into my patient's room, introduce myself, provide privacy. I'm going to wash my hands. I'm then going to verify my patient, making sure I have the correct patient, checking their name band and their birth date. And I'm going to put on my gloves, explain the procedure to them. The most common site for an IM injection is your deltoid. Just make sure you know all your other IM sites. The most important thing with your IM injection is our angle, which is going to be a 90 degrees like you're playing darts, and you're going to spread your tissue. So I have my medication. I'm going to clean my patient's site in a circular motion from the inside out. Let that air dry for a minute. Make sure your bevel is up. Spread your tissue. Inject the medication slowly. Take the needle out the way the needle goes in. You're going to put your safety cap on, put it into a sharps container. You're going to take a 2x2 and massage your area to help disperse the medication. And that concludes how to give an IM injection.